great example is the South Korea individual. She ended up infecting over 1,000 individuals by going to one church service.
The lady you just heard from, she's an expert tracking the spread of the coronavirus in Brownsville. The numbers reveal a lot about one population group, and it is a concern for some health experts. Channel 5's Rudy Mireles joins us with a breakdown.
Over the last few weeks, we've shown how the curve is flattening around the valley. But as more data does become available, experts are warning that although the state is reopening, residents need to remain cautious when trying to return to regular life. Now, this is the curve for Cameron County. As you can see, we have the numbers starting to bounce up and down just a tiny little bit, between 10 and 15 cases per day over the last 2 weeks. Now, when we break down where those cases are coming from, we have these numbers right here. Harlingen has the highest count, but if we take away the number of cases of residents in the Veranda and Windsor Atrium nursing homes, that number is cut in more than half, from 197 down to 91, making Brownsville the highest number of residents in the community at large with 163 cases. Breaking those cases down by age brings us here. The colors on this chart represent the 4 CDC age categories based on risk to see complication. Green is mild risk, younger people. Yellow and gold, moderate to severe risk, middle-aged people. And red represents those over 70 at risk for severe complications from contracting the coronavirus. Now, according to the breakdown, the bulk of Brownsville's cases are those under 40. Those in the low risk category right here in that green. Experts say for those younger residents that haven't seen complications, the temptation to not stay isolated thinking they're not actually sick is a problem. Jones explains why that young category right there is worrisome for public health.
They could be spreading it at that moment too, especially if they're asymptomatic. And the CDC also recognizes that there's pre-symptomatic transmission. So 48 hours before you are symptomatic, you are spreading, or it is believed that you are spreading the illness to other individuals.
Yesterday, physician advisor at Valley Baptist Medical Center Harlingen, Dr. Christopher Romero, echoed that very same concern.
That is a real key in the spread of this throughout the community. They're the ones that, because they don't have symptoms, don't think they're ill, are able to go out and about and spread it within other institutions, within the community at large, and be that transmission to those very vulnerable populations that are very high risk for needing hospitalization and could even pass away from it.
At both the city and county level, elected officials are reminding residents issues being seen elsewhere now show that while the curve is flattening, we're not out of the woods yet, and recommend that people should continue practicing guidelines and wearing masks even if it's not a requirement. In Brownsville, Rudy Mireles, Channel 5 News at 6.